I'm Dr. David Junkin with Seaview Orthopaedics. Undergoing an arthroscopic rotator cuff repair can be very stressful. Just to review some of the details about the surgery, it is poke hole surgery. No major or large incisions will be made. Post-operatively, once you have your dressing off, you'll be able to see these dressings and in many cases cover them with Band-Aids if necessary. Through these small incisions, the rotator cuff will be repaired. The rotator cuff, just to remind you, is a series of tendons that attach to the top of the shoulder in this location. Through small incisions, looking with a camera, anchors will be placed into the bone, which have sutures attached to it to reattach the tendon back to where it anatomically belongs. Following surgery, you will be placed in a sling and abduction pillow. This is to protect the repair. You'll need to wear this sling and abduction pillow until your surgeon instructs you that it is no longer necessary. On average, this is 6 to 8 weeks following surgery. For the first 6 to 8 weeks following surgery, I recommend patients not to actively move the shoulder under its own power. In many cases, there's no restriction to moving one's elbow or wrist, but if you have additional instructions not to do so, they will be provided. As for moving the shoulder for hygiene, you can use your opposite arm or have a loved one move that arm for you. There's no restrictions in those movements. If there are, they will be provided to you by the surgeon. That is called passive motion. That'll help to maintain the motion and prevent some stiffness. In fact, when you start physical therapy early on, passive motion will be only initiated. You will then be given proper instruction, not only by your surgeon, but by the physical therapist as well, as to when it is appropriate time to be able to move the shoulder under its own power. Doing so is called active motion. Usually at that time is when the sling is no longer required. In most cases, the sling is no longer required after 2 months. However, for the next 2 months, meaning from 2 months from time of surgery to approximately 4 months from surgery, you still need to protect the repair. During that time frame, I advise my patients to use that arm only for feeding and hygiene. You will be given additional exercises and instructions that you may follow as well. Each repair is different and must be treated as such. There are small tears and there are large tears. The large tears obviously will need more time and more protection. And in some cases, a patient's tissue, meaning the tendon quality and bone quality, also need to be considered. Try to avoid any overhead use of the arm and no heavy lifting, pushing, pulling. Typically that means about 5 pounds. However, depending on your course, you will be guided by your surgeon as to what would be appropriate amounts for lifting, pushing, pulling. At approximately 6 months, there's adequate healing of the rotator cuff. There should be no restrictions. However, there may be soreness and the occasional discomfort in the shoulder. This is common for upwards of a year or even a few months after 1 year from surgery. This should steadily decrease in frequency and severity over that time. If you have any additional questions regarding your recovery from rotator cuff surgery, please reach out to our office and we'll be happy to answer what questions you may have.